Staff vacancy is a well-understood concept defined by fewer people working in an organization than the planned and budgeted headcount. In healthcare, budgeted headcount is planned against patient or resident population and acuity. Staff vacancies and planned versus actual headcount can negatively impact quality of care and financial metrics. But what are the main factors that drive staff vacancy up or down? A simple analogy here will serve us well. The bucket is your organization, and while it may feel like there is complexity to staffing levels, at its core it's pretty simple. The water is your staffing level, which is directly impacted by losing people to turnover or high rates of 90-day or first-year turnover. The hose is your talent acquisition function, and if it isn't bringing in enough applicants or not processing them fast enough, your staffing levels drop. The hole in the bottom of your bucket is your turnover rate. When visualized like this, it's easy to see the two factors driving staffing levels: how many people come in through your hiring function and how many people go out through turnover. If you have more than one of these challenges happening at the same time, you might have real issues with your staff vacancy rate. It's easy to see why it's hard to keep the bucket full. And with historically low unemployment rates across key healthcare roles, what used to be a labor pool is now a labor puddle. Most of the people you want to hire already have jobs. They are in someone else's bucket. For talent acquisition functions, the state of the labor market has driven 3 key metrics to historic highs, while driving 2 other metrics to historic lows. Further complicating these market-level challenges is an underinvestment in talent acquisition. Even among top-performing health systems, spend per hire is 75% less than other industries like manufacturing, high-tech, retail, and banking, despite healthcare's more challenging labor market. We also know from our lean human capital research that the average recruiter is carrying 50% more workload than is optimal, which means we are underinvesting in recruiting headcount by 50%. One obvious and direct way to address this challenge is to hire more recruiters, but many organizations are better served by trying to reduce turnover rates. Less turnover takes pressure off understaffed recruiting teams, while also improving overall staffing levels. At current turnover rates, the average hospital is effectively replacing its entire workforce every 6 years. And while that's a pretty daunting task, it's nothing compared to the long-term care industry, where locations are replacing the equivalent of their entire workforce every single year. In the senior provider space, turnover rates are typically around 2 to 5 times higher than in the hospital sector. On the low side, annual turnover for RNs in home health was only twice the turnover for RNs in hospitals. On the high side, in long-term care settings, turnover was over 5 times worse than in hospitals, with annual turnover for RNs, LPNs, and CNAs all averaging over 100% in previous years. What does all of this mean? Efforts to close the hole in the bucket have been ineffective. At least for our new hires, we have a bucket where 1/3 of the bottom is just a big gaping hole. The net result? Even when you finally hire people, they flow right back out of your organization and into somebody else's bucket. With inflows and outflows like these, it's easy to see why staff vacancy rates are increasing across all care settings. How much has staff vacancy increased as a result of these forces? In the past 8 years, staff vacancy rate has increased by 115%. A third of all hospitals now have a vacancy rate greater than 10%. This increase in staff vacancy has serious negative effects on healthcare organizations' financial health and the physical and emotional health of patients, residents, and caregivers.